Welcome to the Mental Health Dialogue webinar series. I'm Charlotte Marchandise. I'm the Executive Director of EUPHA, the European Public Health Association, which gathers public health national association in the big Europe, 47 countries of the 53 countries of WHO region, but we work very closely with ADEA and the European Union. This topic is extremely important for us because public health professionals are witnessing a rapid increase in mental health challenges. We also see the increase of the use of digital technology to address mental health challenges. And in this landscape, particularly in the post-pandemic, the digital tools have become essentials in providing accessible mental health support. For us, it's really also very important to ensure that those tools are evidence-based, equitable, inclusive. This webinar will allow us to explore many things and the intersection of technology, privacy, motivation, and of course, the human oversight, all critical for building sustainable and mental health interventions. Thank you for joining. This discussion is organized by 7 EU Horizon projects under the European Commission call for boosting mental health in time of changes. So 7 projects, Advance, Smile, Mentbest, Reconnected, Improva, Bootstrap, and ASP-belong, are all powered by the European Health and Digital Executive Agency, which we will call HADEA for the rest of the time, but now you know what it means. And we are really honored to have you also as ADEA to be represented today. The Mental Health Dialogue is a space where researchers, practitioners, and policymakers come together to discuss the latest trends, challenges, and advancement in mental health care. Today, we will explore pressing concerns regarding the integration of digital technology in promoting, supporting both mental health and well-being. Mental health digital tools are becoming cornerstones, and we must ask ourselves, are these innovations genuinely enhancing mental health promotion, prevention, support, or are they introducing new challenges that we're not fully addressing? How do we make sure that those mental health interventions in the new ways of doing are safe, effective, and really serve the needs in Europe? We'll try to answer these questions, and we really have not formal presentation, but engage in dynamic, interactive discussion. You can ask provocative questions. We will do it to our esteemed panelists, and they agree to that. And we really want you to engage and contribute through the chat or the Q&A in Zoom. Let me give you a brief overview of the program of today. So we'll start the webinar with an opening speech by Mr. Stéphane Hogan, Head of Unit of ADEA. And then we'll have lighting talks where all the 7 projects will share how they use their digital application for mental health support within the project. And they'll all have 3 minutes. And then we'll have a moderated discussion with some key questions for all of them, focusing on data privacy, user motivation, adherence, and the human in the loop approach. And then, of course, we'll open the floor for Q&A question, and we'll close and tell you to keep connected for the next steps. I hope this was clear, and we really like now to give the floor to Mr. Stéphane Hogan to deliver the opening speech. The floor is yours, Stéphane.
Thank you very much, Charlotte. My name is indeed Stéphane Hogan. So good morning. I'm from the Health and Digital Executive Agency, which we will call HADEA for short, where I'm the head of unit for health research. HADEA is responsible for the implementation of various programs on behalf of the Commission, such as the Health Cluster of Horizon Europe and the Mission on Cancer. But first, I'd like to thank you for this opportunity to say a few words about mental health research. I would also like to convey my apologies on behalf of my colleague Sarah Brazis, who could not ensure to be here today. But I would like to say that we're both very excited about this cluster of 7 projects and the considerable efforts that you are making to work together and what this could help deliver. As you know, mental health challenges have been on the rise globally, and especially the COVID-19 pandemic, which has only magnified this need for comprehensive support systems. The European Commission has recognized mental health as a critical issue and has significantly ramped up its support for mental health over recent years, including via research and innovation. The EU for Health program and the Horizon Europe program stand at the forefront of these efforts. As you know, the Commission announced a comprehensive approach to mental health with 20 flagship initiatives and EU-level funding opportunities worth 1.2 billion euros. These initiatives aim to integrate mental health into broader healthcare policies, acknowledging its pivotal role in societal well-being. Horizon Europe, in particular, is actively supporting projects that integrate digital innovation, such as the sister projects, if we can call them so, organizing the webinar today, in order to enhance mental health promotion, mental health services, and overall care. As we look ahead, digital applications have the potential to revolutionize how we approach mental health care by making support more accessible, scalable, and personalized. Digital platforms can provide real-time interventions, bridge geographical gaps, and offer innovative tools for prevention, treatment, and recovery. From AI-powered counseling apps to virtual reality therapy and telemedicine services, these applications hold promise for reaching more people, particularly those in underserved or remote areas. However, as we embrace this potential, we must also ensure that these tools are evidence-based, user-friendly, and ethically designed, always placing the individual's well-being at the forefront. Today's seminar is an important opportunity to share insights, discuss challenges, and explore how you can collectively harness the power of digital solutions to provide effective, compassionate, and inclusive mental health support. I wish you a very fruitful meeting. Thank you.
Thank you very much. And as you said, what is really terrific, I think, about this project is having 7 projects working together. And that's what Europe is for, is that we can collectively amplify our voices and collectively learn from each other. So thank you very much for setting that out. Now, have you seen? If you're not, you can vote and tell us where you're from, because it's also very important for us to ensure equity. And we like to see where people are coming from and to see if we address all Europe. And if not, how can we proportionate our efforts to talk to everyone? And now I'd like to move to the lighting talk. Each project, each project representative will share how they use the digital application for mental health support. And I'd like to welcome our first project representative from Advance. And all of you, if I can ask to introduce yourself briefly, your name, your role, your project, and share the key element about your project and the potential benefit for user. The floor is yours. Go ahead.
Thank you so much, Charlotte, for this invitation. It's very nice to be here in this panel. So my name is Anne de Graaf, and I'm a technical officer at WHO in the mental health unit. And WHO is part of the ADVANCE project. So the ADVANCE consortium is a consortium of research partners and implementation partners focusing on mental health promotion and on prevention in the field of mental health. But today I will mainly represent 1 or 2 partners work within the ADVANCE project. So there's multiple trials and multiple research projects going on in this ADVANCE project, among which several trials on low intensity interventions. But the one I would like to speak about is the STARS intervention, which is a digital chatbot for youth with psychological distress. Thank you.
Thank you very much. That was clear. And please, maybe we can put the link, and all of you can put the link of your project on the chat. So if people want to save it, we'll share it also at the end. Now I'd like Smile to come in.
Yes, thank you, Charlotte. Thank you, coordination team, and thank you, Stefan, for the opening speech. So hello, everyone. I'm Abib Nasser, PhD in data science. I'm CEO at Erdia, French SME developing mainly digital solution. And we are partner in the EU project SMILE. So briefly in SMILE, we co-create and we develop useful digital services and tools to support and motivate young people assessing their mental health while focusing mainly on depression and anxiety risks. Also, we intend to assist clinicians to make faster diagnosis and accurate decision via an explainable decision support system. So mainly we develop two user-friendly applications. Firstly, the companion mobile app that allow them to collect higher quality of data collection and developed by the app, and thanks to the assistive chatbot provided by the University of Maribor. So this mobile app also provides extra digital feature to increase the discoverability, the engagement, the awareness about the benefits of positive mental health and the active aging well-being of young people. And another, a second user application is a CBT-driven application gamification app, and it allows adolescents to learn new skills, new coping skills, practices and competencies to increase their cognitive flexibility and resilience against depression and anxiety risk. So through personalized gamified scenarios and digital intervention, for example, from starting by storytelling, focusing on positive thoughts, and resolving problems in stressful and specific conditions, we try to increase their resilience against mental health risks. So at this stage, we are developing a first prototyping by integrate all these models together in order to be tested and provide useful services and tools for both young people and clinicians. So that's all. I'm happy to be in this webinar and can provide more details about our tools later if needed. Thank you.
Thank you very much indeed. We will deep dive into the project. Now I'd like to give the floor to Mentbest. I think Caroline is.
Yes, hello. Also from my side, I'm happy to be here and super interested in hearing about all these other projects. Thank you very much. Today I speak as a part of a duo. So I'm here with Nana Everson, our Chief Director Operating Officer of Monsenso. And my name is Carolina Einhof. I'm a researcher from German Depression Foundation. We work together in Mentbest, which is a project with several parts, but we speak about one big of them, which is the development and test of the Mentina application, a digital intervention for people who are suffering from depression or are at risk of depression. Digital interventions for depression have been around for a while now, and they have accumulated an impressive evidence base showing respectable but not immense efficacy. And especially when they are guided by healthcare professionals, we know that they work quite well. Content-wise, these interventions are often very similar. They have like these classic 6 to 10 week cognitive behavioral therapy programs, and it has been like this for a while now. So I'm happy to hear today that other partners are stepping beyond this, and with Mentina, we will do this as well. Mentina will empower users to collect and understand their own data and to do so on the long run. When I say data, I'm not only talking about self-report measures, but passively collected sensor data. This is available with no extra effort from each mobile phone of the users. Based on those data sources, our users will receive personalized content recommendations and informational articles and exercises that fit their current needs in the Mentina application. A sophisticated rule engine will continuously scan the data for meaningful connections. For example, if for an individual user, there is a relationship between their physical activity as tracked by their phone sensors and a change in the mood of the next day, then we will learn about this and give information on it through a feedback message in Mentina. The user will also then receive a content recommendation with information on depression and physical activity if they want to dig deeper into this. With this strategy, we want to empower users to better understand their own symptom trajectories and connections to their everyday life, thus giving them the chance to work on changing behavior that is relevant for their own mental well-being. So to wrap up, in the Mentina application, we will try to combine the best of two worlds. This includes materials based on CBT that have been found helpful before, and we will add to this with highly personalized content and feedback that help users to better help themselves, because that's what all psychotherapy interventions for depression finally do.
Thank you very much. Many questions are raising to me in all what you're presenting. That is going to be a fascinating discussion. Now I'd like to give the floor to Reconnected, please.
Hello, good morning, everyone. Also for me, it's great to be here and to hear that so many people joined the webinar. My name is Annette Kleiboer and I'm an associate professor in clinical psychology at the Vrije Universiteit in Amsterdam, and I'm the PI of the Reconnected project. And in Reconnected, we develop and test web and app-based self-guided digital support system with several intervention tools to improve the mental health of vulnerable populations in Europe. And sorry, I have a bit of a cold. And with these vulnerable populations, we focus on people with low socioeconomic status in France and Kosovo, on migrant populations in the UK and in Spain, and older adults in the Netherlands and Switzerland. And then we have a last group of youth that we focus on in Denmark, Finland, and Germany. And that also means that we adapt all these interventions that we develop to the needs and preferences of the populations. And the interventions are implemented in a platform that's co-owned by two consortium partners. It's called Moodbuster, owned by Inestec in Porto and the Vrije Universiteit here in Amsterdam. And it's really designed as a research platform and generally not used for a routine practice or for upscaling. To finish off, the interventions will target mental health literacy, community participation, and psychological resilience, so different kind of components. And the psychological resilience we target through something called micro-interventions, and that is supported by a machine learning algorithm. We might talk about that later. We are still developing our intervention tools, so for us this discussion is very timely, and I'm keen to hear what everyone has to say and what solutions people come up with also to deal with difficult issues that we discussed today. Yeah, and that's it for now.
Thank you very much. Now we have Improva.
Yeah, I'm pleased to meet you all. My name is Rüdiger Brüss. I'm from the University of Würzburg and also from the University Hospital of Würzburg. By training, I'm a computer scientist, have the professorship on medical informatics at the mentioned institutes, and my part in Improva is the technical part. My group is doing digital health and digital applications for the medical discipline for now over 10 years. We have developed so many digital health application. This was the reason to step into Improva. And here the main part of us is we have developed a platform that encompasses a lot of modules. We use 3 modules here. A module where the psychologists and all the medical experts in the project can create their own interventions that we are using for more than 10,000 students all over Europe in different countries for strengthening their mental health and well-being, so they can create this on their own. So this is one peculiarity, and the second one is that we're using a mobile app to monitor the students, their parents, and also the teachers throughout the project. And we also have a web-based platform where they can do interventions. So creating the interventions on their own, using it on the platform, using the mobile app, a co-creation process. And we are now in the stage that everything is established, and we will start the randomized controlled trial now next month in 4 European countries for more than 10,000 students in schools.
Thank you very much. Now I'd like to give the floor to Bootstrap.
Yeah, good morning, everybody. I'm happy to introduce Bootstrap. So Bootstrap stands for Boosting Societal Adaptation and Mental Health in a Rapidly Digitalizing Post-Pandemic Europe. So a long title. So what's it about? It's about problematic use of the internet. And we are addressing this issue in 12 to 16-year-old students in 9 countries. And we have specific phases of the study. In phase 1, we are just assessing data. So these data are on determinants of developing problematic internet use. And based on machine learning, we will have some kind of characteristics that we can use in developing our intervention in the next phase. So the next phase is on a pilot study, and we will establish 2 interventions, 2 candidate interventions, focusing on emotional regulation in the one part and on inhibitory control in the second part. And we will have a follow-up, of course. And based on these data, again, with machine learning, we will develop some individualized algorithms. So looking at specific risk factors that we have and the efficacy of the second part. And finally, we have the trial in which we compare 2 different randomized and not randomized allocations. So the one will be randomized and the other will be based on algorithms which are developed in the first part, so that we have personalized interventions, and we hope that these personalized interventions will work better to tackle this issue of problematic internet use. That's it in a nutshell. Thank you very much.
Thank you very much. And last but not least, ASP-belong.
Good morning, everyone. My name is João Dias. I'm assistant professor at University of Algarve from Portugal, and I'm here representing project ASP-belong. So I also would like to thank the opportunity to be here and the invitation to be representing ASP-belong project in this webinar. So what is then ASP-belong? And what we're trying to do is exploring this concept which we call augmented social play. So augmented comes from the idea of integrating or using augmented reality to merge the physical and the virtual world. And then we also explore techniques of immersive storytelling, interactive theater, and evidence-based psychology. And our idea is then to use this type of interactions to create digital interventions aimed at improving mental health of adolescents. So that's the main idea. Now, how do we do this exactly? I can give you an example. So ASP number 1 that we are currently developing, and we already have a proof of concept. Here we explore the idea of Lina. This is a game that happens in a classroom setting. So, and the children within the classroom setting, they are playing the role of students from another class, a fictional class. And one of the students went missing, which is Lina. And the idea is that children, with each one equipped with their own smartphone, they have to search within the classroom for clues that are specific markers that we have. And based on that information, they will find information about what happened with Lina. And then they are matched together and they have to collaborate, first in pairs and then in larger groups, in order to try to find out what happened about Lina. So, and this is designed in a way so that we provide several opportunities for positive interactions to unfold within the classroom setting, thus aiming to improve the classroom dynamics and supporting real-world connections and sense of belonging. And by doing that, we hope that we are able to achieve a positive effect in their mental and social well-being.
Thank you very much. I hear so many interesting things and how everything is really evidence-based with scientific approach to know that we're doing the proper thing. I hear also a lot of empowerment of all of you and how you co-creation was the key word. And also that it's not only directed to young people, even if a lot, because we know we have a challenge here, but also to vulnerable groups. Where we know the challenges also of co-creating. So congrats to all of you. There's absolutely something that is essential when we talk about all these kind of tools, is how do we improve the digital literacy? I know we're talking about data, we're talking about algorithm, we're talking about AI and all these kind of thing. And people are not that trained. And when we talk about the digital native generation, we actually know that they don't know that much about what is behind the digital thing. One question we'd like to address to all the panelists, and maybe you can raise your hand and I'll give the floor on the order you want to intervene, is the data privacy concerns, because recent studies reveal growing user skepticism towards digital application, particularly regarding data privacy. And how does your project address that, the security for user and within the interaction of your digital tool, not only how it addresses and how you communicate it? So who'd like to begin? Go ahead, please.
I'd say from Mentbest point of view, what is very important to us is that if we cannot convince the users that the solution is safe, is secure, then it may risk affecting enrollment, it may affect adherence, it may affect dropout. So what we do when we present the app to the users is that there's of course an initial login, and the app is protected by PIN code at all times. The data are encrypted in transit and addressed, and what we do to communicate that is that we ensure it in the participant information, and they get a welcome email, and we also emphasize it there. We of course collect consent from the participants to collect the data, and also on the sensor data part, we have to have consent to each and every sensor, and they can always withdraw their consent again. But it's also a point, of course, when we do the personal recommendations that Caroline mentioned, that it's not coming in a notification. It's not a notification that anybody can see on their phone if the phone is on the desk. It's a notification that comes in a message module inside the app. So we work on multiple levels. We also ask, we have a co-creation network, so we ask what is important to you, and of course try to address that in our documentation and in our communication with the participants.
Thank you very much. Rudiger.
During COVID-19 with the German Robert Koch Institute, they approached me and saying, okay, we need for monitoring mental health an app in Germany. And they approached me because we are adhering to the medical device regulation. And then we are also measuring with each data collection, with each questionnaire, the GPS position, if the person is allowing it. And then everyone said to me, and also all the privacy officers, there will coming no GPS position because data privacy is a real problem. And in the end, over 90% provided their GPS position, and saying in the end, okay, you are an official institution, no company behind it, so we trust you. First experience. Second experience, we created an app where you just have the possibility on 8 dimensions to regulate in a very coarse-grained way, or in a very sophisticated way, what things you want to allow and what things you do not want to allow. And we saw in this research project that this is overwhelming the users. Data privacy is an issue, but to make it complicated, then this is also nothing. You can give it in the hands of the users, but this is not the way you should do it. It must be, you have to have privacy by design and create trust. But on the other hand, to give it in the hand to the users, and I will share also in the chat then the publication for this, what I'm saying at the moment. But this is really not easy. We must work on issues for privacy and security, but by design.
Thank you very much. Very clear. Anne, please.
Yeah, with regards to the STARS intervention, so I'll give a little bit of a background on the intervention itself first. WHO designed the STARS intervention, which is now currently being tested in the Advanced project, but has previously also been tested in Jordan outside of the Advanced project. So STARS is a chatbot-based intervention, and addressing data privacy concerns were already part of that design phase. So years ago, WHO started with a human-centered design approach in which you combine top-down knowledge on what do we know about what's effective, what are psychological techniques that are evidence-based, together with a more bottom-up approach in which there is this co-creation process in which many, over 200 young people were interviewed across 6 countries and regions to feedback on what would be a useful and suitable and most of it engaging intervention for young people. So they use prototypes to test, would young people be more engaged with videos or with more traditional apps or with a chatbot? And we ended up with this chatbot. So in the design of this chatbot, the things that were considered to protect, well, for these protections of privacy and data is that it does not collect so much data. So participants or users of the website are not writing the answers themselves, so they're not providing data in that sense, but they are making use of predefined answers. And in this way, they are learning new strategies. So they're all based on CBT, cognitive behavioral therapy, and do not provide as such information about themselves. So this is one aspect of the design that protects their privacy, and very similar to what Nana has already mentioned. So it's password protected. People do get notifications in the form of an SMS, but it contains very little information that could breach their privacy. The chatbot is just not conversational in the sense that people can write answers themselves, and input is therefore limited. But the chatbot is also guided. So that means that users will receive 5 phone calls in total once a week by a trained helper, in which that chatbot content is becoming a bit more personal. So that's where personal stories can also be shared. But it's mostly focused on motivating users to use the chatbot and helping them going through the learnings that they have. So the role of WHO in this project is that we developed a chatbot, which has been a process of years, and currently it's being tested in advance. But what we're really focusing on is testing the content, so the intervention itself, and not so much the application. So the goal is that if STARS turns out to be an effective intervention in at least 2 trials as a pooled result, then that content will be made publicly available, and it should be able to be used on multiple platforms. And so that's the second point about addressing, say, privacy and well, protecting data, is that that's another phase in which that has to be considered, but it's already considered in the design of the intervention itself.
Thank you very much, Han. And Jürgen.
Yes, first of all, I missed to introduce myself. So I'm from Germany, from Lübeck, and I'm a psychologist. And I wanted to comment on what Rüdiger had said. So we are collecting data from participants via smartphones, including GPS data and other things. And this is a critical concern, of course. And our colleagues from Ulm, who are responsible for the technical part, developed a method to not use the real GPS data, but it's a random place in the world, for example, in the Pacific Ocean or something like that. So, and that's something that we use for the privacy of participants, and we spend a lot of effort in explaining this. So all this, the safeguards with respect to privacy, we explained in videos that we developed in co-creation, and yes, and translated them to other countries. So that's something that we tried to foster these privacy issues.
Thank you, Habib.
Thank you. So as in the other projects on Smile, we collect various user data, such as personal information, evidence-based question and response, daily emotion, and also diary recording. to assess mood and mood sensitivity. So safeguard is a crucial concern in our project, and that is addressed early by design in our prototype. Our tools are strictly comply with the GDPR guidelines and ethical aspects. And as I said, as other projects, so during the requirement phase, we'll collect consent of all users. We will inform them about their information rights. So in a comprehensive way, we'll tell them clearly how data will be used, how will be processed, where it will be stored, for example, and when it will be erased and use it. So maybe from the technical point of view, personal data in our project are secured and managed via Keycloak server in order to unify the user management, but also protected by combining various security techniques such as JAT, encryption, and the identification. For the patient-related information is well structured and stored in a dedicated file server provided by University of Maribor in order to ensure privacy and protection, data protection. Moreover, we have a specific tool provided by Africa, our coordinator, called SAPL, that is used to enable dynamic authorization and based on user roles and access policies, ensuring secure access through the entire workflow in a dynamic way. And maybe at the end, I can say the two user application, the companion mobile app and the gamification app. In this application, users, maybe young pupil and user, are anonymized and they're represented by avatar in order to protect their identity in the digital world and increase their participation in our ecosystem. So that's all.
Thank you very much, Joao.
Okay, so let me share a bit what I have video on. Sure. Okay, so let me share a bit of our perspective in the ASP-belong project. As other colleagues in other projects also mentioned, looking at this perspective of privacy, this is something that we also do by design when we're looking at how can we create the digital experiences that we're developing. We also have a specific task that looks at establishing an ethical framework. Where some of the things we do there, we did collect a lot of empirical data from the stakeholders involved in both in the design and the final users of the application that we're developing. But we also need to consider some concerns when we're looking at an actual application. So for instance, in my case, I'm working with personalization, but this is slightly different because one of the things we try to do is to personalize the game, not to a single person, but to the classroom itself. So we need to have like a better understanding of what are the pre-existing relations within the classroom. And this is the information that we can use to then do a bit better in terms of how we match them together. When we are creating pairs and groups. So, and that was a very big concern. And how would we ask these questions in order for participants to feel secure, in order to provide this information? At the end, we also realized that there would always have to be an option for participants to opt out, and the system would be able to deal with it. So if someone does not want to provide this information by any reason that the participant might have, then we must be able to ensure that the system will still work anyway, even without that piece of information. So that was another example of type of concern that we take into account when developing. And obviously, we also have other concerns like the type of information that might not be anonymized easily. Then we just use local machines and we store that locally in computers that only the researchers have access to, so that information is not accessible outside of our scope.
Thank you very much. Annette.
Yes, thank you. I don't have a lot to add because a lot of things have already been mentioned, and we have it relatively easy compared to previous projects that I've done, because our system does not contain any identifiable information. People don't not have to give their names. We don't need IP addresses and stuff like that. So that makes it relatively easy to make it secure and private. One thing that we are still thinking about is there are a lot of like misconceptions about technology, also about algorithms and things like that. So it might be that we offer a really secure, good system that is safe, but still people might think that information will go anywhere and things like that. And we plan to devote a few stakeholder meetings on this topic, like how should we explain this best to people so that they also know that it's good, that they have choice, that they have control, they're not forced into doing anything. So that's a bit of an ongoing process, but that's something that we are aware of and working on.
Thank you very much. Yes, trust is not something that you get by default. It's something you build, and you build by design, as several of you have said. You build by structure and legislation. GDPR is important, and being in an EU context could also be a big importance in building the trust with users. It's also maybe at some moment we would need to address also the untrusting network, and we know there are some very dangerous algorithm going on there for the use. So we probably need to have open talk about that. Before I go to the next question, I'd like to read the very interesting remark of Charis or Caris, I don't know, I'm sorry if I don't pronounce it well, saying that we talk about mental health as a big concert in Europe, but yeah, in mental health challenges, because everyone has a mental health, and we put kind of everything in mental health. So when you answer next question, it could be interesting to have you explain how do you present mental health? Do you use a medical model? What do you put behind mental health? Because it's quite interesting, and there are quite interesting challenges when we talk about mental health or well-being. What do we put there, and how much it's a personal place, medical place, societal, political approach? I'd love to hear from you. I'd like to go on the next question, then we'll go for the open talk and address the other questions of the chat, and which is, how do we sustain the user motivation and adherence to the project? Because it's crucial. How do you, in your design, you ensure the privacy, but on your design, you not only motivate the initial use, but support long-term adherence, technically and with medical protocols. And of course, I will add with inclusivity, because we know that we're not equal when it comes to staying on the loop, and inequalities tend to be bigger when it comes to adherence of the treatments. And for this project, I'd like to address it particularly, but then feel free to address the other, but to Reconnected, Mentbest, Bootstrap, and Advance. So do you want to jump in for Reconnected, maybe?
Yes, I'm happy to. So I got this question, so I've been thinking a little bit about it. And I think what most of our projects do is involve stakeholders quite thoroughly, like and professionally in a very structured way. And that's also what we do. So we kind of try to build a generic intervention, but then discuss with stakeholders how we can adapt it to their needs, both the content of the intervention, the technology, as well as kind of more cultural adaptation. So I think that's part of, or that's a good start to get interventions that kind of are relevant for the end users, that they can do and they feel relate to. What we try to do, it's a self-guided intervention. So when I'm referring about the medical model, it doesn't really follow the medical model. It's more to build resilience, so people are better in facing all the stressful things that they encounter in their daily life, that they learn how to deal with it, that they get support in their environment, that they are aware of their own mental health. And it has a little bit related to that. We give them a lot of option and choice because it's for their own good, basically. So they can decide what to work on, what would help them. We try to learn from what they do. For example, with an algorithm, what kind of exercises do they prefer? Do they want more of it? And integrate that into the intervention or the digital support system. And we try to do a lot of make it interactive. Work with notifications, all these kind of gamification elements, give rewards and things like that. And hopefully that whole package of different things that we do will appeal to them and also engage them in the intervention.
Thank you very much. Caroline.
Yes, thank you. I really felt when you said people are different in what they need for adherence, and I think that's one of the points why we don't have a strong evidence base right now for what really works to engage in adherence in digital interventions for mental health or to support mental health, as pointed out. So I felt what Kleiber said, that we need to probably try out different strategies and combine them so the intervention offers something for each individual. In our own intervention, we have also several strategies, but one thing that I really emphasized in the design of the material was to catch users by their curiosity. I don't know if it was the same for you. My generation used to read this like youth magazines when we were young, and there was this tests in them, like what friendship type are you? What gummy bear taste would you be? And we knew all these don't make sense, but we always answered them to see what comes out from me, what's the result for me. And this kind of curiosity is what I would like to foster in the users of our intervention, because we want to, through this data collection and rule-based feedback, we want to give them the option to learn something about themselves. That's why in our material and in the introduction of the study, we try to catch them by this angle. I know that this will not work for everyone. It is tiring to fill out an intervention day by day. And even though we collect data automatically, we still need their engagement because we cannot like automatically feel their mood yet. So yeah, I'm curious how this will work. We also have some gamification strategies where they can earn badges, and we heavily support them technically through regular push notifications, because we know this is an important part and can even be like an active ingredient of some digital interventions to just regularly keep them reminding, hey, we're still with you. Please stay with us. But yeah, curious to hear about more strategies.
Thank you. Well, I have Duolingo, so somehow I relate with all this push information, and it's much less personal. Hans-Jürger.
Yes, I want to comment a bit on what Annette has said. So it's a little bit, no, Anna, sorry. Yeah, Annette is right. So it echoes a bit what she said. And basically, we have an intervention that is based on general principles of health development and on health psychology. So we want not to lose any participant because he's not able to have the right motivation or the correct self-efficacy to continue. So what we do is that we specifically have a focus on these two issues. So for example, motivation to change is something that is very important, and most people don't get through the stage of high motivation. And that what we are doing is to look at specific mechanisms. For example, we are going to look at a decisional balance process. So what are the good things of what you're doing? What are the bad things? How can we improve your issues on that? Then we go to self-efficacy. How can you make any changes with your specific behavior, which is internet use in our project. So this is very individualized, and we give individualized feedbacks on that. So this is some kind of rewarding for people getting feedback, and that we specifically design the next interventions based on the motivation that they have and based on the self-efficacy that they have. And they get a lot of feedback, and they get feedback on if there are improvements, for example.
Thank you very much. Okay, now Rudiger. And if you all want also to address the question about how you address mental health in general in the same time, it would be great. Rudiger, over to you.
Having the luxury situation that now doing this for over 10 years and seeing many studies with digital applications for different questions, there are a lot of mistakes, I think, that are often done. The first one is that you transfer from one project the results to another one. For example, we did something in tinnitus and transferred it to mental health in aftercare breast cancer patients. Didn't work. But everyone wants to transfer the results, and we have not much of these. So this is the first thing. Every population is different. The second thing is that often we see that we are doing measures and do not see the problems behind the measures. Gamification is something that is at the moment very often done. This is a good measure, but the problem is if the people then going into a competition, they often do their measurements because of the competition, and then you have the adherence, but you have not a good data quality. So this could be another problem. So and often I see also that with more data, it is not looked at the question, is this data really valuable? Then you have adherence, but you have not valuable data. So you have to have always to look very careful at what you are doing. Then this is just hypothesis, but I think we have still in the medical field, no digital natives with smartphone apps and wearables. We are still in the beginning. And what I also often see here, we have, for example, from the WHO, the MIRA checklist for evidence-based interventions. In so less papers, I do not see this paper cited or used, but the WHO has a checklist for evidence-based mobile health intervention. So have a look at what is done out there. So I think there is the wish to do something, and everyone sees that digital health applications work. But we have the caveats on the other side, and we do not look at them very careful. And this is the reason, in my eyes and my experience, that the data in the end is often not in the way that we want it to have. And last thing, what are we doing? And this will be also done in Improva. We see often that the people see a benefit if they can make to their measurements a context. Just giving a small question, you answer a questionnaire and saying also in which context the person is. This is a demand that often to see my evolvement over time, but in which context my mental health situation was in this. I was in the car, I was in the kitchen, but to see the context when the situation occurred and this over time. This is a small measure, but is that powerful? And do not need a lot of efforts, but can be done very easily. And this small hints that we learned over long years, this will be put into questionnaires. We are using persuasive design to make the things more appealing. These are the measures we are doing. If we have to do a lot of efforts, and we do often not see how they really then in the end the result is coming out. Small measures is much better in my experience, and be careful with a lot of measures where we think that they are successful. They could be, but they must be very carefully looked at.
Thank you. And I'm reading also that John on the chat is asking which measure are implemented in detecting, directing, and reacting in psychosocial crises on the e-mental health hub. And that's a very interesting point also. Is that something I need to do while I'm feeling good every day to pass the data, but also when I'm experiencing mental health challenges and crises. And this is maybe when we should have the data, and maybe when I'm less capable of engaging. I'll give the floor to the three next speakers. Please keep it short so that we can also go to the next question and embrace all the aspects of what we want to talk, and also have some time to give the floor. So still on engagement, Habib.
Yes, thank you. Just I want to briefly to share our approach to ensure the long-term engagement in Smile. So in the simple way, we are enhancing the user experience by making the user application user-friendly, easy to use, and intuitive. So more the future are comprehensive, more clinician and young people are engaged and aware about the benefits of it. And also we are motivating them by rewarding their participation, sharing their data, and based on their achievement. So young people will be rewarded and their level will be higher based on, for example, the self-reflection provision, the accuracy and consistency of on responding the questionnaire. So the system is not the rewarding and leveling system is not yet tested, but as said, Rudiger will pay attention that are not using our tools only for the smiles, for competition to win, yes, these rewards. So that's the thing.
Thank you. Interesting. Anne.
Yeah, I heard a lot of things that I'm not going to repeat that we also include in the STARS intervention, such as notifications and so on. But one thing that we noticed did help in user engagement and, well, mostly engagement in our trial in Jordan, so which preceded the Advance Consortium, is that we had a call with participants, because it was part of an RCT, before they embarked on their real journey with the intervention. And this was what we called an engagement call. And we learned this from quite a successful implementation in Lebanon on another digital intervention, that this engagement call in which people were could ask questions over the phone to the engager about the project, about the expectations, was really helpful in attracting the people who are likely to follow an intervention like this. Because for STARS, it's not only a chatbot intervention that you can do on your phone, on your laptop, wherever you are, whenever you want, but it's also that guided component. So it's the engagement call that we hypothesize is quite important for the engagement overall in the trial, but also in the intervention. But we also know from meta-analytic evidence that guided self-help is more effective than unguided self-help. So this is an integral part of STARS, and we think that will help with engagement, but potentially also with adherence. And then maybe one, sorry, Joe, one comment regarding mental health. I mean, point taken on the website. I'll take it back to the team, and I agree with the comment. But perhaps important to emphasize is that for the STARS intervention, it's more in the realm of prevention. So people who want to participate in the intervention do not need to necessarily meet the diagnostic criteria for a mental disorder, but it's for young people with increased distress. So it's not necessarily related to a particular mental health condition.
Thank you for making that point. Joao.
Okay, so just briefly, my experience and our perspective in ASP-belong. There are a lot of things that we already do by design in order to achieve immersion and engagement with users, because some of the things we're doing are actually games. So we designed the experience to be fun and engaging by design. And there are other aspects as well, the fact that we use technology and use augmented reality and represent something, this is quite new for the children to interact with. So this is kind of also positive. But what I would like to highlight, which is something that we're exploring, and this is not explored as often in other projects I've worked with, which is this idea of using storytelling as a way of keeping participants engaged. So for instance, we have the idea of a mystery. At the beginning, the participants don't know what happened to Lina, and they uncover bits and pieces of what past experience, stories with Lina, and eventually there is this buildup of a story that they will eventually find out what's happening with Lina. And I think this really helps to keep users and participants engaged in using all the sessions. So that's what I would like to put forward as our perspective, which I think it's different from more traditional approaches.
Thank you. Very interesting point. Like, talk to me about myself, like my horoscope or this kind of test, like Caroline said, the storytelling, keep me engaged with the mystery. Very interesting point. Also, I'm taking the point about the transfer of intervention. It's something we worked a lot in public health. Like, it's not because something works in Finland that it will work in France. So how do we create the condition where it works? And I think that goes back to your first round on co-creation. Now, and it follows with what Anu said about the engagement call, we'd like to go to the next question, which is in the human in the loop approach, because digital tools are valuable possibility for mental health support when you have mental health distress or illness or trauma. The role of human healthcare professional, of course, remains crucial. And I would like you to tell us how your project integrates this human expertise and oversight along the digital intervention, and that they ensure that human practitioners are involved and will jump in when it's necessary. And would like for this question to specifically dedicate it to Smile, Improva, ASP-belong, and Advance, and other. You can feel free to add something also if you need. Would like to jump in. Yes, go ahead, Joel.
Sorry, I was muted. So again, our perspective is at least, sorry for this. So when we look at the type of interventions we create, we never see them as something that will replace the experts. So our idea is this to be used as tools that could complement what is already being done. So for instance, in our case, so this is this is something we're designing for classroom settings. So this could be either part of the curriculum, or this could be as an additional intervention that in some particular type of classes. And the way we see is that it's not only about doing the intervention, but there is also like a follow-up discussion that is really important to further highlight what were the issues that were being considering when they were playing the game, and to really to allow participants to think about these aspects. And then here the intervention of the professor, of the person that are accompanying or applying this intervention is also very important. So we do not, our perspective is this is not something to be used isolated, but we do believe it needs to be integrated with experts that are using this as a tool to enforce or to apply a given intervention. That's our perspective.
Thank you, Habib.
Yes, thank you. So firstly, we can say that all our solutions, Smile and Service, are co-created through living labs in a collaborative way. And also we believe that humanizing tools will not only increase the confidence in treatment or digital intervention, but also will ensure greater trust and retention on our digital tools. So in Smile, our goal is not to substitute clinician, but provide them tools and assistive tools in order to ensure faster assessment, accurate follow-up, for example, after a treatment. That's why we are putting clinician at the core of our digital intervention and decision process. So the final decision will be mainly made by the clinician, as we can trust 100% the machine. So also we offer various services to help professionals to visualize results during the whole phases and workflow of the project or the process of treatment of the mental health cases. And we enable them to make informed and accurate decisions. Just in Smile, we have, for example, our questionnaire or evidence-based questionnaire are triggered automatically. But now we are authorizing, for example, clinician to trigger a specific questionnaire for a personalized remote decision or demand monitor. So the objective is to involve the clinicians or professionals in the whole workflow from pre-assessment till the treatment. Also, in order to humanize the ecosystem of the process in Smile, we are giving young people, for example, the possibility to provide their own observation via, for example, in the mobile app, where they have, for example, reflective exercises. And the game, they have, for example, gamified storytelling to not only consider objective measurement, but also subjective observation. And In our recommender system, we are trying to integrate empathy while providing digital assistance and recommendation to increase the involvement and the role of the human in the whole process. So that's all.
Thank you very much, Anne.
Yeah, so for us, having the human in the loop is incredibly important and crucial. So although the telephone guidance in STARS, but also guidance in other interventions that are being tested in the advanced consortium are delivered by non-specialists, so people without formal mental health background or training. But that doesn't mean that mental health professionals are left out of the equation. They get a different role in the delivery of mental health services, but they do have a crucial role. So it's in line with what many of WHO's psychological interventions have, which is a task shared approach whereby non-specialists and specialists divide the tasks in delivering mental health services. So specialists will get more of a role in supervision, in the training of non-specialists. So their role, they're basically still part of that delivery model, but in order to supervise and train people who actually deliver the intervention itself.
Thank you, Rudiger.
In Improva, which is led by the coordinator in Spain, Rodrigo Lima, he did a very careful co-creation process. This is the first measure that Improva is doing. The second one is that we have the situation that we are using a journey where we include also with the digital health application the teacher, the parents, and the students. And so this is very tightly integrated. With the medical or the domain experts and the technical solution, I think this is the second measure that is the human in the loop dimension. And the third one is that we are using the app with ecological momentary assessments and also patient-reported outcome measures, and have defined a protocol where we have feedback and cycles where we try to incorporate very quickly if we see that something is going wrong. And this results through the apps are very quickly reported to the whole team and also to the non-specialists. So this task sharing is also done in Improva. So these are the measures what we are doing.
Thank you, Annette.
Yeah, maybe we don't have a human in the loop, basically. And I want to explain why or our considerations, because I think it's well known that having a human in the loop adds something in effectiveness, but also in a crisis and anything. There's also some evidence that it doesn't add that much when you have you're not very symptomatic. So if you're kind of low level of symptoms, we consider our intervention more health promotion, and we decided not to have a kind of human in the loop for reasons of scalability at first. Like, it's so much easier to scale up an intervention for a large population if there's no human, no infrastructure needed for coaches or anything else. But what we have built into the intervention is we try to teach people how to help themselves. So we will offer them options like, what if you get a mental health problem, for example? Where can you go? What can you do? If you have or know somebody who in your environment who has a mental health problem, what can you do, and stuff like that. So it's from that perspective, yeah, we have a different approach in this project. Not saying that a human in the loop is not necessary or not important, but it's something we thought a lot about, and this is our kind of perspective in the project.
Very interesting discussion. Anne, you wanted to intervene and answer to that.
No, not intervene so much, but I'm happy, Annette, that you make that point, because indeed we do not only need guided interventions, and we need that whole range of interventions that can that are suitable for different groups of people. And you're completely right from an implementation perspective. It's so much easier to implement an intervention that is completely unguided. But I do think it's important to emphasize that we need all of these types of interventions that address the perspectives people are coming from.
It's also in a very quickly changing world. I've heard more and more people, especially young people, saying that, for instance, ChatGPT is more empathetic to them and more helpful than their psychiatrist. So not saying it's true or false, I'm saying it's that people say, and that are the things that we also need to have a talk about, knowing where it comes from and how it works. Now we'd like to open the floor. So if people in the audience have a question, we'd be happy to pick your question, and you can raise your hand if you want to ask your question on camera and directly to our panelists. And that's on the moderation side. You can also put the question. We kind of addressed a little bit the issue about how we talk about mental health. I don't know if some of the panelists you read the question of Caris and the remarks of Caris in the chat, and while we're waiting for question, if some of you would like to react on that. And I'll read it for if some people cannot read it. Caris said that the ability of every person to cope with equanimous mind, aka mental health, to their daily situation experience is affected not only by their temperament and the choices they make, but also the systemic pressure that they're going through, especially for young people, and through all the changes and pressure. So how do we have an open perspective and systemic transgenerational perspective in the apps? Anyone would like to address that? Yes, please go ahead, Anna.
Yeah, I'll do an attempt because I'm not quite sure if I fully get it. But I think an important aspect of perhaps many of the interventions or apps being discussed today is that lots of that relies on self-help strategies that people learn to better cope with daily struggles or problems that, for example, young people face, and not so much on diagnosing or detecting what is wrong. So it's a lot focused on skills building that are skills that are deemed assumed to be generic for people to cope with their distress. But I'm not sure if this is an answer to the question asked.
Let me be a little bit provocative and see how I understand it. I mean, do we want the people to adapt to a world where they have lots of pressure and they're facing challenge on an individual scale? Or do we take into account on our intervention that maybe we know that at least in Europe, we have like something like between 40 and 50% of young experiencing eco-anxiety. And it's not an individual answer only. It's also like this political global answer. When we talked about them, how to cope with the challenges, some challenges are not only on personal competency, they are also on larger competency. And can we talk about mental health distress without taking into account the global environment in where we are living? And I think that's also a connection with the next question. But if you'd like to react on that, yes, go ahead, Joel.
Okay, so I can share a bit of our experience regarding the question from Caris. And here our perspective is that we can at least address this partially in the following ways. That in the example I'm going to provide, we try to do that. So for instance, the game we designed a game, and the game is around bringing people together and having collaborative positive experiences to improve the dynamics, the social dynamics within the classroom. But there was a second goal with the application, and it was to raise awareness about problems of children that have parents with mental illness. Now, not children themselves, but children that have parents with mental illness. And so our goal was to use a bit of perspective taking, because Lena is indeed a child of someone that has a mental problem. Her mother is having problem with depression. And what happens is that during the game, children will eventually understand some episodes that happened with Lena, and they will better understand why she reacted in a way that was not normal for them. And so the goal behind this is that we're allowing participants to have a better understanding of Lena's perspective and why does he act in a given way. And so I think we could do something similar, picking up other stories and using this idea of perspective taking to increase awareness and to make people understand what is to be in someone else's shoes, and to try to understand what are the type of problems that they face, and that it's hard for them to face as well. So, and here is that if we are able to, the hypothesis is that if we are able to raise awareness, people will feel more empathetic towards persons that have this type of problems, and eventually they will provide more social support that eventually might help with dealing with these difficult situations.
Matt?
Yes, I'm also not 100% sure that I give an answer to the question, but I think it's definitely important. We live in a kind of bigger world than just your own coping skills and stress that you encounter in your daily life. And in the Reconnected project, we have some people experts in complexity science in our consortium. So we take that approach, and so we have a kind of, you have environmental factors, you have social factors, you have societal developments. All things will influence mental health in the end. And we try to investigate what are the most important factors influencing mental health in specific people. It's just so hard. Most of us in the consortium are also psychologists to change these really societal developments. So we focus more on individual. What can you do to help yourself with your own stress? And we think that in the end, that will create, say, citizens that are more capable of dealing with these bigger events. And hopefully that will kind of work towards these bigger goals that we cannot change so quickly. And of course, but some are for other people, like some decisions are to make for politicians or other people in the world. But as an individual, I think it's so hard to do something about that. So that's our take on it. Like, we will get some information on what are important factors, but yeah, just these coping skills and stress regulation, that's something that we can help people with.
Anne, you had a burning remark to respond to that, and then Halbi will give you the floor.
You saw it in my facial expression. Okay. Yeah, so it just made me think. I mean, there are, of course, interventions beyond psychological interventions that address these social determinants of mental health, such as economic interventions, cash transfer, etc. And I mean, I do think we do focus on teaching people self-help strategies in the STARS intervention, but it doesn't. I mean, it's not to ignore that there's other determinants that influence people's mental health. There is also a partner in the Advanced project that specifically focuses on young people dealing with climate distress. I'm feeling uncomfortable to say too much about it because I'm not that much involved in that project. But there is definitely attention paid to these other determinants also within the Advanced project. But one can also think about combining interventions that are more environmentally focused or economic interventions together with these psychological interventions, which is combining cash transfer with psychological intervention for young people growing up in poverty. And there is evidence that this augments the intervention effects. And so
thank you, Anne. Before giving you the floor, I'd like to mention two things. Like Didier de Masso, who is a clinical psychologist from Cameroon, is pointing out that this intervention can be necessary, but very difficult to implement in humanitarian area. And he's asking you two questions, if you'd like to react at one moment on self-care intervention and cyber-psychology. And Habib, before giving you the floor, I think Gary stood up and we can take your question directly. It will be much better. So the floor is yours, and then I'll give back the floor to our panelists. Go ahead.
Thank you. Greetings to all. My question is inspired by the mental health themed tool fair that the European Commission organized a year ago in Ireland, where people there were talking about the two-directional approach to mental health. So you have mental health illness and symptoms where people need the support. They need to be assisted to diagnose what it is that's going on that they need to be helped with in order to have a more balanced life. But there's also health of the mind, so peace of the mind, equanimity, as I presented, where you have to help people cultivate that. They don't necessarily need to have mental health diagnosable challenges, but so many of us, or most of us, are living in the dramas of our mind. And if we are helped to understand that most of the things in our lives will change or will pass, and we don't necessarily need to be so anxious imagining the worst case scenario about what's happening to us or the world around us. There are also things, systemic issues, that violence and so forth, that we need to take a position on, either ourselves as individuals or ourselves as professionals to support young people. So that's why I'm advocating for this two-directional approach, because there's mental health challenges and then there's the mental health that needs to be cultivated on a daily basis in schools, at home, within families. There's also intergenerational pressures or financial pressures that people have to respond to. So we have to help them understand how best to respond to those daily challenges versus just diagnosing, oh, I'm going through an anxiety or depression disorder. So that we can also catch them and, like you said, prevent them from getting to a point where they need to have a medical diagnosis. So I hope that clarifies things a little bit. Thank you.
And now, Habib, you have a lot to reflect upon.
Yes, just maybe a comment. So in the gamification app, only young people are users. So, and maybe in the awareness mobile app, we are providing a specific feature, it's called peer support, where, for example, that we are enabling experienced pupil and adults, maybe parents or teacher, that can share their experience and learn skills, competencies, for example, to focus on positive thoughts, how to be more flexible facing stress, via typical, we can say, thematical discussion where they can bring young people together and try to share their experience with them. But we are imposing in this peer support, we can say, rooms, the presence of qualified moderator and professional in order to avoid any concerns and issues during the discussion and sharing their experience. So maybe that can be, yes, a way to share skills and experience. That's all.
Thank you. Does someone else want to react on everything that was said here and also Didier's questions on the chat? No, nothing more here. So maybe now I'd like to give the floor to Stéphane. Do you like to give some closing remarks on this panel? Oh, Stefan is not here anymore. Sorry for that. Okay, so any closing topic, any closing thing, or shall I wrap up? No, you all said everything that you had to say. So thank you so much for the questions, contribution today, and this dialogue, and also for sharing all the ways you're doing that. I keep the key point about the importance of evidence-based innovation, data privacy by design, but also by law, ensuring human oversight, even though there are debate on that and different intervention on the chat. Most of the people were convinced that we need human in the loop. And also the need of collaborating with healthcare professionals, but not only. You talked about teacher and how we have also to put them on the loop and help them with better digital/mental health literacy. Technology will support personalized care, not replace, and maybe we don't want that either. You also pointed that technology should be accessible, effective, driven by the needs of individual, empowering and addressing social inequalities and vulnerable people. And maybe the last open discussion, which is something I hope we will discuss in next European Public Health discussion conference in Lisbon next month. What is behind the mental health crisis? What do we put into innovation, the individual, but also the collective level, and how health is a political choice? And I really believe that all the things you're doing, all the data, all the science you're raising can actually inform politicians that maybe it's not your user, maybe it's not you directly, but it's us as a larger association and connecting between the science and all these EU projects to policymakers and bringing it to the parliament so maybe we can make better policies in the future for the mental health of all. I'd like to remind to all of you that it's the second webinar of the Mental Health Dialogue series, jointly organized by Advance, Smile, Mentbest, Reconnected, Improva, Boostrap, and ASP-belong. Be sure to register for the next session. You have a QR code to continue this conversation. The webinar series will be every 4 months, and you have the registration link on the chat, as well as the website of all the 7 sister projects. Thank you once again to all the speakers and participants, and let's keep the discussion open. Have a great day.